Like a lot of you know, spring break is just around the corner, and I'm sure a lot of you have probably made plans. You're probably also aware that our city's weather is fairly inconsistent. It'll be freezing one day and about 140 degrees the next. Like, it's crazy. But it's these hot days that we really look forward to because that means we can go to the beach. Go ahead and picture it now. The sun keeps you in a sense of toastiness as the ocean breeze keeps you from exceeding anything above that level. You sit back in your beach chair as you listen to the harmony of crashing waves and Drake's new album, More Life. But this harmony is soon interrupted by a crying mother. Her son lies unconscious in the sand. There are no lifeguards around, but action needs to be taken. You hear somebody scream, "Does anybody know CPR?" Well, luckily, you will. Today I'm here to show you the proper CPR mechanics in order to save somebody's life. Now, this scenario could really happen to anybody: a loved one, a close friend, or a complete stranger. But can you imagine how rewarding it would be if you were the one that saved their life? Everybody would look at you like you're a hero. Now, as a licensed EMT, I know how to properly get you ready to get this gratitude. Now, CPR consists of three major steps. First, conducting your primary assessment, notifying 911, and giving the compressions and rescue breathing. Now, as far as conducting your primary assessment, what you're going to want to first do is verify that they're completely unconscious. Now, this is done by simply calling out their name or calling out sir or ma'am. Now, there's a chance that they might not be able to hear you, so you're going to want to also give them a little tap on the shoulder or rub their sternum. This way you can verify that they're completely unconscious. Now, after that, you're going to want to check the carotid pulse. This is done by checking the neck above the carotid artery. So, after tapping the shoulder and calling out sir, ma'am, their name, you're going to check the carotid pulse and verify that no pulse is present. After, you're going to want to assess their breathing. This is simply done by looking at their chest and observing if there's any chest rise and fall, indicating that they're breathing properly. So, if there's no chest rise and fall, no carotid pulse, and they're completely unconscious, you're ready to perform CPR. However, you're going to want to notify 911 beforehand, or at least have somebody else do it. This is simply because your efforts might not be enough to save this patient. Also, professional medical personnel has access to certain equipment that might be essential to saving this patient's life. But after you've done that, you're ready to conduct CPR. Now, the first step of CPR is the compressions. Now, what you're going to want to do is place one hand over the other with the palm of the bottom hand on the bottom of their sternum. The sternum goes along vertically towards the middle of their chest. So, as so. Now, you got to be careful because CPR for an adult and a child, they slightly differ. Now, if this were an adult, you would want to make sure that the force of your compressions doesn't allow you to exceed a depth of 2 inches into their chest. Now, in this case, it's a child, so you want to make sure the force of your compressions doesn't allow you to exceed a depth of 1/3 the depth of their chest. Now, the rate of compressions for both adults and child is 30 compressions for every 2 rescue breaths. However, if 2 people were conducting CPR on a child, it had decreased the compression rate to 15 compressions for every 2 rescue breaths. So, you want to keep your compressions fairly rapid, about 2 compressions every second. So, on the sternum, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, all the way to 30. Once you've conducted your 30 compressions, you're ready to give your rescue breathing. Now, if you're afraid of cooties, by all means, if you have a pocket mask on hand, go ahead and use that. But before delivering your breaths, you gotta open up the airway. This is simply done by tilting the forehead back and the chin slightly up. As so, forehead back, chin slightly up. After you've done this, you're ready to give your 2 rescue breaths. And there you go. So let's recap. I've shown you how to properly conduct a primary assessment, why it's essential that you notify 911, and how to perform the compressions and rescue breathing themselves. Now let's get back to the beach. Everybody's calling out, "Who knows CPR?" And you answer the call. It's time for action. Everybody's got their phones out, they're recording you, they're on Snapchat. The mom is in your ear, she's screaming, demanding that you save her son. You have little room to work with, but you stop. You take a deep breath. You have the skills. You just need to apply them. So you regain your composure and you begin your compressions. You're doing your compressions. You're breathing, compressions, breathing, compressions, breathing. Nothing seems to be working, but you're so focused on saving this kid's life that you keep going. Compressions, breathing, until finally you hear a gasp. The boy regains consciousness. He's crying tears of joy along with his mother. Everybody around you is clapping in your honor. Congratulations, you've saved the life. My work here is done.